cancer with the Care In Foundation. The CEO of Cormode Cancer Foundation, Dr. Denise Ejoh, will be hosting a cancer patient and advocate, Elizabeth Ugwoma Awo-Ejeh. Over to you.
All right, Dr. Ejoh, good morning and welcome.
Good morning, how are you?
I'm fine.
Cormode Cancer Foundation. Cormode is wrong.
All right.
Okay.
I've been doing it for 5 years. Please help me. Somebody sent a payment to me and said Cormode, and it had to bounce back.
Really? That's fine.
Anyway.
Okay. So
morning, guys. How are you doing?
We're doing great. So you have
Absolutely
the show now.
Amazing.
Thank you. Let's go. Morning, viewers. Welcome to another edition of how do you say it now? Kakaki Cancer Awareness on AIT, brought to you in partnership with Cormode Cancer Foundation. I am Dr. Denise Ejoh. Welcome. Good morning. It's very nice to have you on this morning. And what are we talking about? The best and the worst of breast cancer care in Nigeria. I've got a patient advocate who's going to be talking about it today. So what are we doing? Morning, Elizabeth, how are you? Don't worry.
Good morning.
Together we fight, together we win. So what we're talking about today, we will explore the best and the worst of breast cancer care in Nigeria, stories, systems, and survival. We'll look at how far we've come, where we're still struggling, and the voice transforming pain into purpose from a patient perspective. Joining me is a remarkable young woman whose journey has inspired many across Nigeria and beyond. Elizabeth Awo-Ejeh, fondly known as Duchess Lizzie, is a passionate breast cancer survivor and advocate for cancer awareness, and somebody who worked at some time in her life doing some work experience on AIT. Is that correct? Good morning, my darling.
Good morning. Good morning. Thank you so much for having me.
So through her powerful story of strength and victory, she empowers others to embrace hope, courage, and resilience. And she uses social media a lot. So let us now, using her platform, let us openly start this conversation as she reminds us all that her scars are not signs of pain, but symbols of strength, victory, and a renewed hope of purpose. Have I said it correctly?
Yes, ma'am.
Yeah. I told you I would. You thought I was going to get it wrong. Okay, now let's go. Let's have a relaxing, enjoyable time. I'm going to call you Lizzie throughout this call. So you've experienced both the personal and advocacy side of breast cancer.
Yeah.
When you look at Nigeria today, what represents the best for you on breast cancer? What gives you hope? I want to hear your side so I can see my side. I just want to see what the differences
are. Okay. For me, can you hear me?
Yes, we can. We can go on.
Okay. So me, one of the best for now for me, it's awareness. Like there's massive growth of awareness now. People are talking about cancer. I remember when I opened up about my journey, it was kind of difficult because I didn't see much people talking about it. So it was just like I was in my own shell. But now I've seen massive growth of, people talking about it. And for me, it's one of the best thing so far, because awareness is very, very important. Early detection do save life. So and we are breaking the silence in women. So that's one of the best. And also one other aspect I also want to talk about is the fact that most times, hope you can hear me?
Yeah,
please?
go on.
Okay. I remember when I was diagnosed, and it was a devastating experience for me that you have breast cancer. And most times when you hear news like that, you just tend to like, oh, it's a death sentence. People don't really survive it. And so the more we talk about it as cancer survivors and, lived experience, people who have really gone through it, it's another way it can also help other people who just got the news. So for me, the hope I have now is that we have more awareness and people are not getting informed about it, to check their body and to go for screening. Yeah.
Thank you. I think I would align with you on that. One of the best things that has changed is awareness. And one team I'd like to say thank you to is AIT. AIT brought it on 4 years ago, and we have never missed one. I think October this year will be our fifth. Yeah, this particular program, the first program we ever had was in October, second week of October, this same time in 2021. Yeah. Oh, well done, AIT. Thank you, thank you, thank you, thank you. So you see, awareness has really taken a long way. What awesome, AIT. Thank you. We really appreciate that. Okay, so I'm going to ask you a next question. After that, I'm going to come back to you're going to share a bit of your story, but I want you to answer this question. What gives someone like me hope, and I'm sure it's you, is that more women are speaking out about this, and I think that is really great. So when we look at diagnosis and where we're going, we're more appreciative of it. So my next question becomes, now flip the coin. What would you say remains the worst reality of breast cancer care in Nigeria? It's good to talk about the best, but let's talk about the worst. You are muted. You are muted.
Yes, sorry, my network. So let's talk about the best, right? Is it the
The
best or
worst.
the worst?
The worst.
Okay. Uh, okay. Okay. For me, the worst is the myths, the lot of myths which have cost a lot of lives. Some women believe that breast cancer is a spiritual attack. Some other believe it's a cause. So, and then that means most people, are going to experience the symptoms. They are going to have this signs. And then because of that myth, they tend to kind of delay in assessing treatment, in going for this screenings. And I've seen women who will say, okay, I will pray instead of, going to the hospital. I'm going to pray and then it's going to disappear. So I'm not saying that, okay, praying is wrong. I'm saying that as you pray, please go get yourself checked. And I know it's part of the cultural belief that we have here in Nigeria. Not just Nigeria. I think it's an African kind of mentality where people just tend to see it as just spiritual attack and cause, and then it delay. And I know that it's the worst, in receiving the treatment. So that's why I tell my story, and that's why I keep, speaking up, because I know when someone just watched me now and say, oh, she's a breast cancer survivor, and then that means we are breaking the silence. We are telling people that cancer is not a death sentence. You can go check yourself, and early detection and treatment, and then it works. So yes. So thank you.
That actually, you're absolutely correct, but one of the things that I think, and you rightly point out, is the fact that people don't talk about it, and they don't talk about it because of stigma. There's no need us lying about it. People don't talk about it. I spoke to someone yesterday who talks about her cancer journey, but cannot yet talk about it on air or cannot talk about it in public spaces. And I know that there are lots of people like that whose voices are very loud, but unfortunately, they're not ready to let the world know, and I get it. I don't know how I ever started getting my own voice to the head, but I think I had the right. My secondary school classmates helped me. That's it. They helped me to come out and say, okay, I had this disease. So yeah, I think we have to agree with that. What's your story like? Tell us your story. Briefly tell us your story.
Okay. My journey started in 2022, 2021. Sorry, I noticed a lump on my breast, and I was just 24 years old. And we people, if you read, and now that when I was diagnosed, I used to think that breast cancer is for older people. You have to be 40, 50 before you can even get diagnosed. So for me, I was not even thinking that it's cancer or anything related to it. I was like, oh, it's hormonal, it's my period. And so I waited few months, and then the lump did not disappear, and I went to the hospital, but unfortunately I was dismissed without, the doctor asked me to go for any breast ultrasound or any scan. He just checked and like, oh, you're okay. And that was how I went back home, and I stayed for months, which almost cost my life. And I finally decided to go seek a second opinion. So I went to a different hospital, and luckily for me, they asked me to go to do a scan, a breast ultrasound scan, and the scan result came out as fibroadenoma, that the lump is a non-cancerous lump. I was like, okay, it's not cancer. And still, I was not given a proper counseling on what to do. So I went back home. I stayed for another month, and that was when all the symptoms, the discharge, and the lump keep was increasing, and I went back to the hospital, and I have to redo all the scans, and lo and behold, the result came out that it's cancer. And I was so scared. I was like, cancer, how? And funny enough, prior to that, I've never kind of, been in a gathering where they even talk about cancer awareness. I don't even know how to do breast self-exam at home, so I don't even know what it meant. And for me, it was like an eye opener for me at that time. And then it just dawned on me that I was actually, all the signs I was seeing, there were signs, there were symptoms, but because I was not well informed, I don't know what to do. I've never been opportune, to be in a gathering, or like have that information about it. So that was why I delayed. And then my first visit to the hospital, cost me too. So, and that was how my journey started. So from there, I was referred to another hospital, to start my treatment. So I went through chemotherapy. I went through mastectomy. I lost my breast due to cancer. I went through radiotherapy, and it's a long journey because I'm still on a 5-year hormonal therapy, which I'm currently on. And so my journey, my experience, just try make me realize that sometimes we neglect our health. There are symptoms, there are signs, but because and awareness, it's most of us, maybe we are ignorant of this thing, of this symptom, so we tend to just ignore it and just let's go ahead with our life, and then it's spreading and so on. So for me, if the first hospital I visited was able to like act faster, or me push more harder, I think I wouldn't have been diagnosed as stage 2. But I give God all the glory because I'm here, and I'm here to use my story to inspire and encourage other people to prioritize their health, and to do the needful. And thank God for October, which is Breast Cancer Awareness Month, where we get to talk about it. We get to sound the alarm so that people will know that yes, we mean business. This is serious, because we've lost our sisters, we've lost our mothers, we've lost so many people due to late diagnosis. And yeah, so that's why I'm passionate about sharing my story. Thank you.
It's very interesting, but it's also quite sad. When I think about this year alone, I think I've had like 5 people come on, and the doctors didn't do the needful at the right time. And we have lost at least 2. I think you even know 2, which shouldn't have been. Because why did you go from 1 to 2 when you were the one that submitted yourself? Nobody told you. So, and this actually is something that bothers me. So maybe it's something I will bring back to a different conversation sometime in the front. Because we can't, it's not just about breast cancer. Breast cancer, you see the lump. But there are other cancers that you don't see any sign, and then they just die. And it wasn't because they didn't present themselves. It's because the doctors didn't do what they're supposed to do. Okay, I'm going to ask you a question. The policies.
Okay.
We have, if you were given an opportunity now to sit with policymakers or hospital management, or even to go to the House of National Assembly now to speak, what is just one urgent change that you would ask them for? When you finish your own, I'll say my own. To make breast cancer care more equitable in Nigeria.
Okay, I think maybe I should say 2, but okay. So I would say that make cancer care affordable and accessible. And make machines available. I know how I waited, to even start my radiotherapy. I have to go there and plead. They will tell you, oh, machine have breakdown. There's no, some of the parts, are spoiled. They need to order. So we need to make cancer treatment accessible, affordable. And another thing I also want to talk about, because most times we don't really talk about it, we should not forget survivors. Let's not forget survivors. After treatment, many women struggle emotionally, financially, to just want to get their old lives back. I know it's not easy, to get your old life back. Maybe some of the cancer survivors that I know lost their job, some lost their spouse, and they're trying to start up their life. So me now, I'm pleading that we should have like something like a survivor support system where we can integrate survivors back to the society, because beating cancer is another thing. I tell you, it's another thing, and it's a long journey to say. Yeah. So let me stop here. There are a lot of it, but let me
Okay,
stop.
I will agree. Your first one was the equipment. Yes.
Yeah.
The equipment is essential, and we have to accept that. I think actually, let's put it together. We are taking this opportunity to plead with the government to make this equipment in every state.
Yes.
Maybe not buying the machine, maybe lease arrangements might be better, but they have to find a way, because maybe with leasing, because I know that most European countries across the world, they tend to use lease. Why can't we use lease? Then we can't be hearing us breakdown, because whoever you got it from has to change it, and then there's no delay. Okay, I agree with you on that one. The second one you said, and so I'm not going to say anymore because you said your own too. And your second one was patient thing. Okay, my own is mental health. Mental health is severely bad damage, and it's not good that everybody just leaves us to go and find a way to solve your problem. It's not that easy, because losing a breast, losing an arm, losing a leg, losing a this, losing a that, and we don't get support. You're right. Okay, my final question to you, and this is, now it's pink October, so that's what they call it. As we mark Breast Cancer Awareness Month, what message would you like every Nigerian woman and man, men do get breast cancer, to take away this October? What's your message?
Okay. So my message is, today I'm wearing pink. So for me, it's more than pink. It's a survivor. And why October is it's a month where we talk about it. So my take home to everyone who is listening is just use this opportunity this month. Let's not just limit it to just October, to prioritize your health. Go for regular screening. Just book that appointment that you've been delaying. And you also mentioned that, yes, men do
Your
have breast
time is
cancer.
up, madam. You got 1 minute to say your own.
breast cancer. Yes, thank
Yeah,
you.
thank you. Thank you, my darling. It's very nice to have you on. Let's put it this way. Our scars are not our shame. They are our strength. This is our story, and we want every survivor to carry it with their heads held high. Together we fight, together we win. So beautifully said, Lizzie. Thank you for your courage, your voice, and for being here with us. Thank you, viewers. As we round off this conversation, I want to say a very big thank you. Pink October edition of Kakaki Cancer Awareness. It's to remember breast cancer is not a death sentence. When with early detection, we can treat, and when faced with courage, you can overcome. I want to thank you all for joining us today. This month, we're going to be having quite a lot of various people talking about breast cancer, and it was just right to start this month with a survivor herself. Thank you very much, Lizzie, for joining us. Thank you, viewers, for joining us, and I'll see you again all in 2 weeks. Have a fantastic day.
All right, thank you so much, Dr. Denise Ejoh. Always interesting to listen to you talk about these issues. Incidentally, Ukeme here is also very vast in health matters, and she's very interested in what you've been talking about.
Quite interesting one there. And as a very important footnote, did you know that men also get breast cancer?
I heard her say that with her guest.
Yes, men also do get breast cancer. But that's discussion for another day. Right now, we're going to be having Kakaki Entertainment and Lifestyle.
Our message is very clear. Together we'll fight. Together we win.